Taoiseach, the National Service Plan for the Health Service will see €750 million stripped from health services this year. And this is on top of €1.5 billion that has been taken out of the health service by this government and the previous government over the last 2 years. This morning, Taoiseach, I received a copy of the Dublin North East Regional Service Plan. Now, the HSE has asked that this be kept confidential, and no wonder. It makes grim reading. And I think I have a duty to make it public. Is the Taoiseach aware that for the third year, the budget for this region will be reduced, this time by a further €120 million? Are you aware that this plan expects up to 400 staff to have retired by the end of this month, plus a cut of a further 561 staff jobs? Are you aware that it's planned to cut 205 long-term beds in our older people's services and the 2 nursing homes, both in the constituency which I'm honoured to represent? St Joe's and RD and Cottage Hospital in Drogheda are being considered for closure, and right across all the services, from mental health to older people to hospital services in the North East region, which is also the region which has seen the largest increase in population since 2006, that this will see one cut heaped upon another, and that this will be replicated across the other regions. So, Taoiseach, do you agree that this depth of cuts to our health services is totally unsustainable? And Taoiseach, how can the health service deliver safe and effective care with this level of cuts?
Thank you, Deputy. Taoiseach.
I point out to you, Deputy Adams, that the budget for health this year is £13.5 billion, a further £330 million in a capital programme, and that excludes the development of the National Children's Hospital. This is the one area where the government have made sure that adequate monies are pumped into the system. What's been wrong, Deputy Adams, has been the way that that expenditure has been spent, the effectiveness of how it's spent, and the delivery of services for people who need them. Health is always about patient and patient care. I'm aware that in Northern Ireland, for instance, of which your party are very reluctant to put their heads above the parapet, you're laying off 4,000 healthcare staff, reducing the budget by 4 million, and you had 26,000 people out on strike in a one-day situation last year. You can't come down across the border, which you tried to move for 30 years, and say you're that you have a different prospectus down here. You lead your party, and you are required to participate in the situation in Northern Ireland, which you feel you can come down here and cast a different reflection entirely. Look, Deputy Adams, I visit many of the community nursing hospitals around the country, and community hospitals. Many of these are old buildings. There's no doubt about that. St Joseph's, for instance, is a listed Georgian building, over 150 years old. It provides accommodation on 2 floors for 23 people, 19 long-term residents, and 4 respite beds. Now, you know and I know that older people do acquire an attachment to a locality and to a building because it's their home while they're the residents there. But surely in this day and age of 2012, is it right that we should continue to provide services in a building that's 150 years old, that's listed and is beyond the planning conditions for development in many cases? And you cannot close any of these without adequate and proper and full consultation and adequate notice from the HSE. So I know that you got a copy of a leaked plan. I know that you've been on Loud FM this morning about this. But we have to face reality here, Deputy Adams. And I have to say to you, I met last night myself personally at the Cabinet Subcommittee dealing with health. And every one of the RDOs from around the country, every one of the managers in respect of the hospitals have now signed off on their plans and signed off on them for the continued delivery of the best services, despite the fact that numbers of people, significant numbers of people, decide voluntarily to leave the health service as part of the programme that's in there. So that's the situation. We have to face reality, and we will.
Thank you. Deputy Adams.
Well, I do face reality, and Sinn Féin's position, Taoiseach, across this island is entirely consistent on all of these issues. Now, you say you want to see the continuation of the best services. This plan says it will not be possible to fully maintain the same level of service in 2012 as in 2011. Not me, not Sinn Féin propaganda. The actual plan itself is saying that. So the impact on ordinary citizens, and all the time, Taoiseach, you avoid this issue of the social consequences of your policy. Between 500 and 900 public nursing beds to go across the state,
Question,
to 4,000 staff. Taoiseach, this government, and I met with the HSE senior people, with Caoimhín O'Quillan and Tomás Sharkey just about 10 days ago. There is no contingency plan for dealing with the 4,000 retirements. So how can the health service hope to cope with all of these additional job losses? Now, you cannot hope to do this while you stick to the recruitment embargo. And don't tell citizens that we can't afford a decent health service. Between 2010, Taoiseach, and 2013,
Thank you, Deputy.
€2.25 billion has been taken out of the health service by your government
Sorry.
and by Féin Féin. I'll repeat that, Taoiseach. Finian, give me a break. Between 2010
Sorry. Please.
Between 2010 and 2012, €2.25 billion.
Sorry, deputies. Please.
€2.25 billion has been taken out of the health services by your government and by the previous Fianna Fáil government. Yet in the last 3 months, you have handed over €2.5 billion to bondholders.
Thank you.
Look at the two figures. 2.25 from the health services,
Thank
2.5 to bondholders. And next month, €3.1 billion in a promissory note will be
Deputy,
paid
come
to
on,
Anglo.
please, we're
So,
over time.
Taoiseach, this is about choices. You're making the wrong choices, and there's no escaping the social and health consequences of your government strategy in this, not least in terms of patient safety. So, Taoiseach, could I ask you to call halt to this now and announce that this plan will be put where it deserves, in the bin, and that you will be part of building a proper, decent, wraparound health service for all the people of this state?